There are not a lot of people, in my opinion, in this country that can do this and do it properly. There is a learning curve, and it's very technique sensitive. Mark does a very good job of it from what I've seen, and I enjoy doing it. It's a challenge, and it's gratifying because so few people know how to do it and do it properly to help these patients. Hi, I'm Dr. Joe Nemeth. I am a periodontist here in Southfield, Michigan. This is Dr. Mark McCawley, who we are very happy to welcome from Fort Lauderdale, Florida. And there are some interesting things that we're going to talk about today. Now, pinhole cases, which can be life-changing in a number of ways for patients. So here was a patient who came in. The patient had been sucking on lemons and therefore got stains and caries all near the gum margin. And so we did what's called pinhole. That is, we brought that gum tissue down and we got a very cosmetically desirable result. The patient was extremely happy, as were we, because if the patient's not happy, we're not happy. And you can see the dramatic difference that we accomplished here.
That is an absolutely dramatic result there. You can see, I mean, with all of the roots showing, with all of the erosion that happened on that, to have a case where essentially none of it's showing anymore is just absolutely incredible. Because it is interesting to note that he talked about the acids. Acids is a huge cause of showing the roots there, because it actually removes some of the enamel, some of that white structure on the top of the teeth there. It removes it, so it makes it look like you've got even more recession than you actually have. But at the end of the day, he was actually able to treat it, to fix it, and this is just beautiful. This is absolutely fantastic.
I want to say something about the pinhole technique. It's not easy to do. It's very technique sensitive. There are not a lot of people, in my opinion, in this country that can do this and do it properly. There is a learning curve, and it's very technique sensitive. Mark does a very good job of it from what I've seen, and I enjoy doing it. It's a challenge, and it's gratifying because so few people know how to do it and do it properly to help these patients. Now you have to remember, when a patient has recession, they're losing gum, yes, but they're also losing bone. And if they're losing bone, the teeth are getting loose and they're risking loss of teeth. So we want to stop that gum recession. We want to build up that gum. We want to stop that gum recession. We want to be able to save these teeth, make the patient look better, but more importantly, be healthier and save the teeth. And this is just one example. Not too much bone loss here, but there are a number of patients where we have a huge amount of bone loss, and if they lose any more bone, they're going to lose those teeth. But if we can build that gum tissue up, stop that bone loss, and stop the gum recession, because when the gum recedes, the bone recedes also, and we have to stop that, and we can stop that and save these teeth.
Yeah, that's an important thing to note. We did get into this over a decade ago. I mean, we were some of the earliest adopters for the pinhole technique, so we've been doing it a very, very long time. And probably between everybody in the room here, we've done more pinhole cases than pretty much anybody else out there. And you need to know what you can accomplish and what you cannot accomplish with the pinhole. And you've got to be able to know how to get these great results. And I'm glad you mentioned the bone loss. The actual recession is bone loss. That's what happens a lot of times with these cases. It's actually bone loss, and people don't realize that. They don't really recognize that that's the problem. Yeah, my gums are going down, you're getting longer teeth. It's not just that. There's attachment loss. There's actually bone underneath that's going away as well. And it's funny you mentioned the bone. At the most recent course, I actually visited Dr. Chow again, who's the inventor of the technique, the pinhole technique. I visited him about a month or so ago, And he's got a new study out that actually shows that when you do the pinhole, you can actually regrow bone in a lot of these cases here too.
Let's see one of your cases, and I know you're doing a lot of pinhole also. So
thank you very much.
Let's
so
see it.
This is actually an interesting case because you can see the eye teeth, the canines were the ones that really receded so significantly there. And we do see a lot of that just because of their positioning in the mouth. So those teeth receded, and we're able to actually get some really nice root coverage on those. So that's something that looks much more natural. It looks healthy, it looks natural, and the patient was very, very happy with that result from an aesthetic and even a healthy and functional point of view there to be able to thicken the gums too.
It looks like a really great result. And these cuspids, the eye teeth, are not easy to do, especially lower eye teeth, because in the lower, we have gravity against us as well as a muscular pull against us. So eye teeth, upper or lower, are much more difficult.
No, I mean that's nice you mentioned that because it takes experience with this technique and with any technique to know what you can accomplish reliably, predictably, and if you go to somebody who's not as experienced, they won't be able to recognize limitations and different things that you have to worry about, like the muscles pulling, the gravity pulling against things. And there's different things that we can do to mitigate that, to actually manage around it, that a lot of people don't know about. So when you get a pinhole done, when you get any recession coverage done, you definitely want to go to someone who knows what they're doing, who's got a lot of experience with it. You don't want to go with someone who just took a weekend course and they're just trying it out for the first time. You definitely want someone who knows what's going on. Speaking about someone who knows what's going on, this is actually a really difficult case that he was able to manage fantastically.
These cases are extremely difficult to do. Why? Because that muscle is pulling that tissue down. And we're fortunately able to compensate that sometimes by loosening the muscle pull as well as bringing that tissue up. But I had a patient, I would never have done this case, but a few years ago I had a patient who came in and she wanted this treated with the pinhole. Well, I didn't think the pinhole could do that. I didn't think the pinhole could do it. How can I do it with the pinhole? That's not possible. But she insisted, so I said, okay, fine, we'll try the pinhole. And you know something? It turned out very, very well. So a lot of what we learn is by what we attempt to do and what works and what doesn't work. And there is a long learning curve. Each case that we do is a learning experience, and so we learn more and more every time we do a pinhole case. And typically, almost all of these cases involve orthodontic treatment, because when orthodontics is done, it tends to have an effect on the underlying bone and the soft tissue and make that much more susceptible to recession and loss. And so
I mean that is something to note, because orthodontics, a lot of times they want to get the teeth in the most aesthetic positioning, but sometimes the most aesthetic positioning, the best looking positioning, isn't the most natural for where the bone is and where the gum is. So a lot of times they'll put the teeth where they're the best looking, but if you don't have the underlying gum or the underlying bone there, it can have issues. And sometimes it takes years for these issues to actually manifest, to actually appear. But over time, you will see things like this happening. You can see the teeth are in perfect alignment, but if that tooth was pushed out slightly here, and you didn't have enough gum, didn't have enough bone to actually resist the pull of the muscle, then this is something that's going to happen in a lot of cases.
By the way, when we do a case, I tell the patient, the main thing we want to do is stop the bone loss and stop the recession. We want to try to cover the root and cover the root as much as possible. And sometimes we can cover the root completely. But more important than covering the root is getting thick, healthy tissue, which will be resistant to further recession and loss. And of course, we try to cover the root. Most of the time we can cover part, sometimes all of the root, but we can almost always get that thick, healthy tissue to prevent or minimize any further destruction.
Yeah, I mean, what we really want to do is save the teeth. We're periodontists. Our primary goal is to save teeth. And this is a case where you save that tooth. If that got any worse, there would be legitimately no attachment on the outside of that tooth. So it can actually come out. It gets loose. It can actually fall out. That's something where if you treat it, you're actually able to regenerate that attachment. You're actually able to rebuild that. And again, some of the new studies are showing that when you do something like this, you can actually build some bone in there too. So that's huge. This is actually a really nice case that came in because it was most of the teeth. You can see on this is their upper right side, lots of severe recession, even some erosions on these teeth right here. But after we treated it, all of that is gone. So that's really nice to be able to do, able to thicken that gum up, able to actually remove it, because there was even some muscle pulls around here, and we were able to reduce those as well. So that's something that's really nice to be able to do. And you can also show the other side too. This is the same thing going on. Lots of recession, lots of notching on these teeth, and we were actually able to cover all of those roots there. So that's really nice because the pinhole, unlike the previous techniques that we used back in the day, the connective tissue grafting, things like that, you can do a full arch, you can even do a full mouth if you need to, because there's an unlimited amount of collagen that you can use for a case like this. So instead of having to do this in several different segments of doing, grafting when you have to use your natural gums, we're able to do this all in one day. So they can go from that to that in a very short period of time. Joe, tell me about this case for you.
Yeah, this was an interesting case. The patient was very concerned about cosmetics, and so we were able to bring that tissue down, and the root does stain much more easily than the crown, and so the roots are yellow, they stand out. It's rather ugly. The appearance is really unpleasant, and we were able to cover those roots and get a great looking appearance. But I do want to mention one thing. In the original pinhole technique, collagen is used. I rarely use collagen. Why do I rarely use collagen? Because my goal is to thicken that tissue. Collagen is absorbed or reabsorbed by the body and does not give us the thickening of the tissue that we generally need. Sometimes the tissue is thick. In those cases, collagen is okay. But many times the tissue is thin. If the tissue is thin, the collagen is not going to long-term thicken that tissue, and thickening is absolutely critical. So we use an allograft material. It's been used for many, many years. We've never had a problem. I do not know of any problems with it. It's very, very thoroughly sterilized. And so in order to get the thick tissue that we really want, we want something that is not going to be absorbed by the body and lost. We want something that's going to give us long-term thickness, which unfortunately collagen, although short-term it looks great, in my opinion, doesn't give us the kind of permanent thickness that I think is important.
Yeah, so I actually end up using a combination approach. I use collagen and the allograft material that you mentioned. So that's how it's able to actually bulk the tissue and it's able to thicken it at the same time. So that's something that's nice to be able to show. And I'm glad you kind of mentioned that the yellowing of the teeth, the staining of the teeth, that's what patients mention the most. They come in, they say, hey, my teeth are getting longer, but they're also getting yellow up at the top here. What's that yellow? And I explain to them that's actually their root. That is the root showing through. So then they understand it more. Hey, I'm losing tissue, I'm losing gum, I'm starting to show more root here. What can we do about it? And honestly, the pinhole technique is fantastic to treat that. We can use the allograft material. We can also use collagen as well. And honestly, that works very, very predictably to be able to get fantastic results just like this.
The reason for the pinhole technique is to prevent bone loss, to prevent further recession, but also there are a number of other things that we want, that patients are concerned about. One is sensitivity. I have some patients come in and their teeth are extraordinarily sensitive. You touch those teeth and they almost hit the ceiling. And that's because those roots are sensitive. Sometimes it's cosmetic. That's another problem. Sometimes it's decay. So when the roots are exposed, there are lots of other problems besides the bone loss that can be problematic and cause the patient's concern. And so with the pinhole technique, we can very often handle almost all of those other problems. We wanted to show you some examples of the pinhole technique, which can be very valuable. Dr. McCawley does a beautiful job, and of course we'd love to help you here. So if you have concerns, if you're getting gum recession, don't let it go too far, because you can risk actually tooth loss and other concerns that can accompany a gum recession.
Yeah.
I love doing these. They're a challenge. Very few people can do them well. They're very technique sensitive, but I love the challenge, and I'm sure Dr. McCawley does as well.
I do. And these are some fantastic cases he shows, and he does this all the time. This is absolutely great. And if you have any recession, anything like that, Dr. Nemeth is absolutely fantastic. He's someone who I definitely recommend.
We'd love to thank you for watching. Subscribe to our YouTube channel. Comments, questions. Just remember, as I always say, if your mouth is not healthy, you are not as healthy as you could be. So, healthy mouth, healthier body. Most importantly, have a good day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.